But first, we also want to talk about the flu, and it's getting to that time of the year again. Joining us right now, we have David Alvarez, who's a medical director, hospitalist with Erlanger's health system here. And I guess first and foremost, kind of tell us what that means.
Well, a hospitalist is basically, we take over where your outpatient physician stops. So a lot of physicians in the community don't admit to the hospital any longer. So as patients come in acutely ill, we take care of those folks and then notify the PCPs of patients' arrival to the hospital and just take care of them for them.
All right. Well, yesterday we talked about getting the flu shot and, you know, the importance of it, the availability of it as well. Of course, Erlanger does provide flu shots as well. But I want to talk a little bit about more of, for those that maybe do not want to get the flu shot and end up sort of getting the flu, because we are now getting into that season. And a lot of people still end up with the flu.
Right. And, you know, one of the things that, from our perspective, we see really the ramifications of not getting the flu shot. You know, we have an elderly population as a whole, and as the population ages, they're more susceptible to the bad outcomes from influenza. So we really do encourage everybody to get vaccinated and to promote better health in that regard. Because it can get pretty ugly in the hospital setting, particularly when secondary problems arise, pneumonias, heart failure, and so forth. So it's very important that people get vaccinated. And
there, you know, there's scares that are going on out there right now, and understandable. We've got, you know, the Ebola, things like that that's going on, but, you know, the flu is still here, and that still impacts a tremendous amount of people, and it, you know, can be very harmful.
Absolutely. You know, sometimes people tend to fail to realize that, you know, 5 to 20% of the population still gets influenza. That counts for 200,000 hospitalizations annually, with, depending upon which year is looked at, anywhere from 4,000 up to 49,000 deaths annually related to the influenza. So, you know, we do have a big killer, you know, here currently that comes every year that we really need to, you know, promote vaccination, because at this point, only about half of the population gets vaccinated.
Now, when it comes to the flu shots, there's also the alternative of flu miss. If you're someone like myself who's just a chicken and won't get a flu shot, do choose to get the flu miss. But sometimes people are worried about that, but really not much to worry about.
There is. I mean, the flu miss is a live attenuated virus, which just basically means it's been, you know, altered so that it's not really, it's alive, but it can't cause infection. It's cold adapted, which means it only can cause replication at the nose. It doesn't get into the lungs. It can't survive in that environment. One of the neat things about that vaccine is this is the first time that the CDC has actually recommended that vaccine for a certain particular age group over other vaccines. 2 to 8-year-olds, from 2 to 8, it's recommended that they receive the flu miss if available. That's the one caveat, though. You should never delay vaccination to get a particular vaccine. So the main thing is always vaccinate, vaccinate, vaccinate.
Now, of course, some of us are still going to come down with the flu, and then occasionally, too, even if you get the shot, you might get maybe a different strand of the flu. But treatment options, they vary. We've got some, you know, prescriptions that are out there, or even having to come see you. But there's light at the end of the tunnel.
Right, there certainly is, and there are antiviral agents that we can utilize. One particularly common one is Tamiflu. There's another one, Relenza, that is available. Generally, with, you know, we like to restrict the use of those to generally folks that have potentially have a bad outcome from influenza. So if you're young and otherwise healthy, you get the flu, you didn't get a flu shot, you just may have to tough it out with some Tylenol and hydration. But if you're older, more susceptible to a bad complication from influenza, that may be appropriate in that setting.
When is toughing it out not the right thing and we need to come see somebody?
Well, if fever persists for longer than 72 hours, other symptoms arise. You know, you seem really dehydrated, or you're coughing up productive sputum, things that indicate shortness of breath, things that indicate that there may be a secondary complication arising. In that instance, it's time to get a hold of a doc.
And of course, the flu season, like right now, it's beginning to kick off here, but how long does it really last? Is it?
Well, it can be, you know, it can start as early as next month, all the way through March in some cases. It's variable year to year. We just got to keep track of it.
And one last quick question here. There's always that, is it going to be worse this year or not as bad as it was last year? Do we really know this?
Nobody really knows. Who really knows?
Well, the best thing to do is just to be prepared and keep yourself protected. And that's why we do have, and we urge you to get the flu shots. And of course, you can also get the flu miss. They do so down at Erlanger as well. You can give them a call for more information. 778-LINK is the phone number, or 778-5465. You can also go to the website, which is erlanger.org/immunizations. And we appreciate you coming on and talking to us. All right, thank you. All right, folks, we'd like to say big congratulations.